Many women, while they're pregnant, start to think of what it's going to be like when they experience labor. And of course it's painful, and for some, they're motivated to do it without an epidural, and others want to do it with an epidural. No ifs, ands, or buts about it. They are not a pioneer for a reason. Whatever your plan is, you are going to experience pain at some point, and there's a lot of different things that you can do to manage that pain. The best thing to do is use basic breathing and relaxation techniques. One of the lines I use most frequently while I'm at work on labor and delivery is take slow, deep breaths. Women have to constantly be reminded that they need to breathe, because if you think about what naturally happens when you drop a hammer on your toe, as far as breathing goes, you hold your breath, and that's what's going to happen when you have a contraction, unless you take breathing out of automatic and put it into manual and start thinking about breathing. Just take slow, deep breaths, and that will get you farther than anything. If you're looking for ways to control the pain once you get to the hospital, you do have options. The first one is an IV pain medication called fentanyl. It's kind of like morphine on steroids. It is a narcotic, and it has the effects that a narcotic will have on you if you've ever had those before. It makes you really dizzy for the first couple of minutes after administration, but then the dizziness wears off and it leaves you feeling drowsy, but it does take the edge off the pain. So for this reason, it's very helpful to women during labor. And it is safe for you to get. We try not to give it when you get closer to delivery, because it's IV medication, and anything that goes through the IV does get to the baby. So this medication can make the baby a little bit drowsy, but that's okay as long as it wasn't administered an hour or two before delivery, because that's about how long it lasts. That also means that you can get doses every hour leading up to the time of delivery, if you please. Now, of course, in addition to this IV pain medication, you can get an epidural, and epidurals are very effective at controlling pain. Women who get one, though, need to understand that it doesn't take away all sensation. Some women think that they're going to feel nothing, and then if you feel pressure, you're thinking it's not working. But that's actually a sweet spot. An epidural helps you to feel pressure and know when and how to push when that time comes, but it makes it so you don't experience the pain of labor or delivery. If you have more questions about any of these things when you have your baby, don't hesitate to talk with your nurse and OB provider. And if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/InterMountainMoms, and recommend us to your friends and family too.